Hello, my name is Douglas Ott, and I'm here to present my community risk reduction plan. Narcotics use has increased across the United States among men and women, most age groups, and all income levels, according to the CDC. Some of the greatest increases were seen in demographic segments with historically low rates of heroin use. Those segments included women, those with private health insurance, and people with higher incomes. As narcotic use has increased, so has narcotic-related overdose deaths. Between 2002 and 2013, the rate of narcotics-related overdose deaths nearly quadrupled, and more than 8,200 people died in 2013. The Rock Community Fire Protection District can play a part in preventing future deaths caused by this narcotics epidemic. A risk often seen on the streets by the citizens within the borders of our fire district is the use and abuse of heroin and other narcotics. The risk of death due to narcotics abuse has been on the rise in recent years and has been endured by this community since 2008. Heroin offers a less expensive alternative to the more costly prescription opioids, and Rock Community should initiate a risk reduction program to reduce the number of deaths caused by narcotics. The problem is our fire district responds to a high number of narcotics-related incidents. Often the overdose patient is not breathing adequately prior to our arrival and is at risk for long-term effects due to hypoxia. The purpose of this risk reduction plan is to make Narcan, which is an opiate antagonist, available in same locations as automated external defibrillators, or AEDs, are mounted, which can be found in churches, schools, department and grocery stores, and other occupancies where a large number of people can be found. Our district protects approximately 65,000 residents within 38 square miles with 5 engine houses and 60 firefighters. The fire district protects a mostly residential community with a large amount of commercial occupancies along with some light manufacturing. The short-term solution to the problem of narcotics-related overdoses is to provide the Narcan in areas such as with the AEDs, with public transit drivers, police officers, public libraries, and stores. The benefit of this is it would make Narcan more available in the event of an overdose and allow it to be administered at the time of the call to 911. A patient may then receive it at least up to 6 minutes sooner than if they had to wait for the arrival of EMS. The effectiveness of making Narcan more available will be studied quarterly. Every 3 months, the number of overdose deaths after implementation of the plan will be compared to the same quarters in previous years. A better picture of the overall value of this risk reduction plan may be more apparent after 1 or 2 years. Long-term treatment options Rock Community could help provide include partnerships with rehabilitation centers to provide care for patients who have overdosed. This will not fix the entire problem, as participation in a treatment program will be voluntary. The patient will have to want to change, and of course, the fire district cannot force them to do so. Hopefully, the most effective long-term aspect of this plan will be providing drug education in schools, both elementary and high schools. Unlike fire safety talks, presentations on narcotics abuse could include entities other than fire district. Our local police department has only one school resource officer who administers their drug abuse resistance education program. Educating firefighters on how to assist the police department can increase the effectiveness of drug education. Since firefighters see the impact of narcotic addiction on a regular basis, they should have a very vested interest in this program. Representatives from the health department, rehabilitation centers, and former addicts would also be included in the program to offer different and more personal perspectives. Just as the fire service has seen a reduction in fires and fire-related deaths thanks to our education efforts in those areas, so too will we hopefully see a reduction in narcotic overdose-related deaths if such a program is as effective on behavior modification. Some of the budgetary requirements for this program will include the Narcan spray itself, which is typically available to the general public for about $180. A Narcan-specific cabinet, which would be mounted next to the AEDs and on public transit buses, usually costs about $50. The cost will be multiplied, obviously, by the number of Narcans placed in the community. Cost also matters based on the number of public transit drivers, police officers, school administrators, and restaurant and retail management who agree to carry the Narcan for us. Funding sources may come from the fire department's operating budget. Ideally, outside funding sources will be found in partnerships with ComTree, the Jefferson County Health Department, and the Jefferson Foundation, which provides grants for drug abuse and addiction treatment. Each Narcan will come with a card, which will have a phone number and email address that can be used to notify the fire district each time one of our partners uses the medication to revive an overdose patient. This will help us to replenish the Narcan more effectively and efficiently, and to keep it well stocked at each location. In conclusion, I hope that the partnership built with the fire district and community organizations can help us all in reducing the unfortunate number of narcotics deaths in our area. Thank you for your time.